Well, welcome, Athens, to a great Saturday morning. And this is Mark Koyman here, and I have some great guests along with Dr. Toby Bond of TMB Medical, that if you don't even know what this man looks like, you can go to www.drtobybond.com, drtobybond.com, and you can actually even see him on some videos that he's going to talk about and see his picture and read about his background. And I think it's pretty truthful what you share on your website, isn't it?
Yes. There's a lot of topics today that we can talk about. You can see how my patient portal works and how the smart house calls and home video calls when that's the subject of today's.
That's right.
Visit.
And your pictures are current. They're not like from 5 years ago.
I had a patient last week in my office.
Did he compare your pictures?
No. They said, "You're getting gray. Are you going to color your hair?" They did. And so
was it my mother?
No. No, I think she told me to lose weight.
Oh, did she? Oh, okay.
So it's like, who's the doctor here?
Right.
$50 a month.
Well, we're going, today's show to our listeners is high touch, high tech, because now we've talked about the high touch, which is the generic product. Now we're going to shift over to the high tech because we have some guests that are with us today. And as we go into high touch, high tech, I'm going to have Dr. Bond introduce our guest, but then I'm going to go back to the high-touch aspect of what technology today is enabling physicians to do, which is going back to the old house calls.
Just introduce yourselves.
Introduce yourselves. All right. So we have a very cool set of guests that are with us. We have Troy, who is across the table from me, and Troy is a doctor, but you're a PhD doctor, right?
Well, yeah, I'm a doctor. It's a clinical doctorate for nursing. So we like to call ourselves like doctor, nurse practitioners is ultimately what it is. We're not physicians.
Okay. All right. And tell our listeners a little bit about, now, are you from Athens?
Not originally. Actually, I'm originally from the Midwest. Grew up on a farm, moved to Athens about 15 years ago, and just could not leave. Absolutely love this place. But about 3 years ago, started a telemedicine company, and essentially, if you think about telemedicine, it's just providing medical services remotely using a video conferencing like Skype, but something that's medical grade and something that's secure.
That's pretty cool. We're going to get into the details of that. And then we have another guest that's with us who actually has been using that product. So share with our listeners who you are and a little bit about your background.
Well, sure. My name is Danny Wright. I am a patient of Dr. Bond's, and Dr. Troy, as I call the Mac DNP. On occasion, I call him that.
In Mac, as in like
Apple. He's the Mac Daddy, but he's the Mac DNP. So I've had so much fun going to them over the past couple of years that just a great relationship that we have. But I live in Athens. I've been here for almost 16 years. I married an Athens boy, and those who are from Athens originally, when those little boys grow up, they don't like to leave. Mm-hmm. So I have been converted to a Southerner from Colorado and absolutely love it and refuse to leave.
Now, do you live in Athens, Clark County, or Oconee
County? I live in Oconee County. I live right on the Athens, Clark County, Oconee County line. So, but I still say that we live in Athens. No offense to Watkinsville. We still love Watkinsville, but
Atlanta is becoming a metro.
Becoming a metro.
Athens?
Yeah, I mean,
are you talking about Athens?
Yeah, Athens is.
Athens.
You said Atlanta.
Oh, did I say Atlanta?
I was like, it's becoming a metro.
No,
it was a metro.
It's hard to divorce the two. Sometimes the traffic in Athens is like being in Atlanta, but no, Athens is becoming a metro here in Georgia, so it's expanding. All right, let's go and talk a little bit about. I can remember because I'm over 50 years old, and I very quickly admit that. But I can remember in my youth the doctor coming to the house. I think my pediatrician came to the house a couple times. Now, Dr. Bond, in your background, do you remember when doctors went to the house?
No, I've never had a house call growing up. I lived on one side of Atlanta. My doctor was up at Piedmont, so we had to drive about an hour to get there, so he never came to visit me. There was one doctor, before he went into politics, was making house calls in Athens, but I don't know of many doctors that make a house call anymore, which is a shame. It's a shame, and because they're bedbound people now. As our population's getting older, they don't have transportation, or they're just bedbound, which is one of the concepts of today, as the concept of the video visit, which is basically is the future of medicine because of people that can't get to the office.
Troy, do you remember any house calls as a kid
You know,
growing up?
it's funny. It's funny how things have changed in healthcare. We didn't particularly had any house call visits even there in the Midwest, but I remember vividly when I was 16 years old and had to have my appendix taken out, that the doctor called my mother and talked to her on the phone, which in essence is like a house call. You just can't see the patient. But I also remember that family doctor actually assisting in surgery. I think that family doctor delivered me. And now we think of that, and it just seems so risky and archaic to think what family practice
I bet in
doctors
small
did.
towns like in South Georgia or out in, I bet there's still doctors, old family practitioners that still make house calls.
I know that
and
if-
carry the black doctor bag around.
Well, you know, when you Google house calls on the computer, you see stories that come up and some blogs about people recalling the house calls and all that. Some of those blogs talk about how, at least within the old house calls, patients were actually more honest and more direct about what was actually happening to them. I see some heads shaking. Danny, do you identify with that?
I do. I come from a family that's got a ranching background, and they lived, 30, 45 miles outside of town. And so they had that family doctor that would make those house calls. And you think about it, having a patient in their own environment is powerful. It's comforting. It allows them to share more. And I think that, that house call that they used to get when my mom was a little girl, allowed them probably to have, an opportunity to take good care of them and give them something that they wouldn't have gotten by having to travel 45 miles down to town.
And today we have home health care, and you get the reports from the nurses from home health care. But believe me, it's not the same thing as seeing the patient. So once you know your patient, as soon as you walk in the room, you know whether, and same thing with a doctor in the ER. As soon as he walks in the room, as soon as he walks in, literally within 1 or 2 seconds, he knows that patient needs to be put in the hospital. Same here. If that patient looks awful from the baseline, so there's a lot to be said seeing the patient.
And especially seeing a patient that you already know, someone that's
Right.
established and you understand. I think that's where house calls and virtual sort of house calls really benefit the patient.
When I started my practice 3 years ago, we just had the top line technology, and I thought it would work good with the concept of the patients that we're attracting, that we're marketing to, and our educated patient base. We thought it would be nice instead of taking historic. Now, we don't do this in my office. I'm usually about 20 minutes late. But taking a whole afternoon to go see the doctor and sit in a waiting room, you have to take either a whole day off from work or a half day off and just sit there forever. So we thought it would be a nice way to communicate. Now, the future of medicine, they just started, the managed care companies like Blue Cross just started paying for it this year. Medicare has mandated that this will be used in the future. But
I'm going to, for our listeners' sake, they don't know what the mechanics of this are and how this operates. And I think it's very important for us to anchor them down, because when we're talking video house calls, one of the things that is very, strong for me when I heard about it is that initially, when you think about video house calls, you think of the mechanics of how we used to do video, hence a physical camera, a tripod, the way that camera had to be shooting you, and then it had to be transmitting over your desktop computer and so on. And I think it's key for our listeners to know that in many of these mobile phones that we have today, which are all over the place, have built-in cameras, correct? And these cameras are actually, Troy, tell us a little bit about that. This device that we carry around with us day in, day out is a device that can be used to do these.
Yeah, that's exactly it. And it's amazing what's happening as far as that sort of technology goes. They're ubiquitous. They're everywhere. Now we've got 4G LTE for Verizon, AT&T, Sprint. And typically what we see with someone who has a home DSL service is maybe they have a 6 megabyte sort of capacity, and that allows them to stream videos and do all that stuff that you want to do entertainment-wise. Well, now with these mobile devices, now we're seeing speeds that are 4 times faster than that. So all this bandwidth really isn't even being used, and it's perfect for video technology. When you get into the hardware, I just bought a new phone just 3 weeks ago, and its camera actually has a higher resolution capacity than my $2 SLR camera I bought just 4 years ago, and it's in this tiny little phone. So it's amazing where it's going. And now we've got companies like Samsung and a few others that are investing in 5G technology,
Right.
and they're talking about 100 megabytes per second.
So
it's
the
amazing.
video capture rate works out pretty
Yeah.
good. All right, and then in the mechanics of this, this is where a time is scheduled, correct? That the doctor goes in on their desk, they turn on their video in their computer, and they contact the patient at a scheduled time, and they converse back and forth through the video visuals. I see over here,
Well, let's
Danny is
explain
shaking
how it
her
works
head.
if you were to call the office. So you call the office. I'm out of town. I can't see Dr. Bono in New York or something, and they said, we can offer it. All my patients know we have it, and they would say, I need a video call. And so, okay, Dr. Bond will, I'm seeing patients, and so they have to find a slot. And we usually do in the afternoon, or Troy will set it up. And so, okay, 3:20, call back on this number, go to this website. So Troy, explain what the patient would do at his end, or explain the mechanics, and then we're going to have a live version of.
Yeah, so typically what happens, and this can happen from within the office, the beautiful thing about this technology, it can be anywhere. We're not talking about a huge, complex system like the tripod and the camera where you have to be in a particular location.
Laptop computers.
You can be anywhere. You can be on call and at home and seeing a patient that way. But typically what happens is that either the patient is scheduled for a follow-up visit to go over lab work or testing or that sort of thing and in a regular schedule, or they call in and say, listen, hey, I'm sick. And in fact, I saw a husband and wife team just 2 weeks ago. They were in different parts of the state, had no idea that they had contacted me. Both were sick with a cold and wanted to be seen.
So they call the office, and then what happens, Troy? The patient goes to your website.
Actually, it's even easier than that. Typically, the way we've set it up, they either go to the website and they get
Which is Smart House Calls.
Which is Smart House Calls. Actually, the portal is examroom.smarthouseCalls.com. That's where the software is located.
And let's tell our listeners that is a protected website, correct? This
Absolutely,
is
fully
not
HIPAA compliant. This is medical grade. This is professional stuff. This is not Skype.
So it's encrypted. So because medical,
Is this like Google and Facebook where the government's looking in on it?
That's a beautiful thing. No, they do not.
So they're not?
No, they do not.
You
look
sure?
at it. Who knows with the NSA? But no, they cannot. Now, what they can do is if
They're not monitoring this radio show, are they?
well, no, it has. That's the key to it. The software has to be secure. So it's like a military site. I mean,
Yeah.
it has to be encrypted.
fact,
That's the thing about.
We went to Fort Gordon and did a demo for them and actually worked on their lockdown computer system. They went, this is fantastic. So it was good enough for Fort Gordon in their telemedicine research center.
So that's what's different about Skype.
Yeah, exactly. Skype. But to go back to how it sort of works, essentially it's so easy that literally the receptionist will call the patient and say, hey, are you ready for your visit with Dr. Bond or Troy? And they will simply say, okay, well, listen, what's your email? I'm going to send you an email. They click on a link that's email. They don't have to download anything. All of a sudden,
they open up their email. There's a link, and they click on it.
They click on that link, and they open up and pop. There's Dr. Bond or there's Troy staring at them, saying hello and waving. And then they simply click on a little button that looks like a microphone. And they begin talking and going through things. The nice thing about the clinician is that if they're dealing with lab work, those sorts of things, that they can simply show the patient through the video portal their lab work. They can show educational videos that pop up on the patient. The patient essentially can just sit back and get all of this information from their clinician, and they can convey the information that's most needed for that particular visit.
And we can actually, it's high resolution, so tell them to grab a flashlight and point it in their mouth. We can look in their mouth just like in the office.
Exactly.
We can't see in their ears. Now, the future, with people that are homebound, we'll have stethoscopes at home that you can listen to at home. And then you have all the home stuff at home with the blood pressure monitors.
Can you, through the video, can you measure their pulse?
Oh, well, you can ask. We can teach them how to take a pulse, and if they have the blood pressure monitor, they say,
If they've got a
say hook
Bluetooth
up your blood
pressure,
pressure
yeah.
monitor and put the pulse on, and then actually we can see if it's irregular, irregular. So we do the best we can. You work with what you have, but it is a face to face. Go ahead, Troy.
Yeah, no, I was going to say that, and in the near future, we'll have, already we've got a lot of devices that are Bluetooth capable. Essentially, it's easy to set up for an individual clinician on a web page where they can connect through a particular sort of Bluetooth connection and be able to visually see those, but those have to be customized and done for each individual physician.
And within this, just again, for our listeners' sake, can as a physician, can you actually, based on those, make prescriptions? Issue prescriptions?
No, absolutely. This is a visit.
So it's like a real visit.
And so another, we talked about the homebound patient, but the traveling patient, like somebody that's in New York City in a hotel room or at a conference room, they just pull up and set a time. Now, as a physician, I can call in antibiotics over state lines. I can't call in pain medicines. No one can. That's federal law. So I can find a pharmacy. Where's your closest pharmacy? Where's your closest Walgreens? Get their number, give it to me, and I can send an antibiotic prescription to New York. Or, now in Europe, they have antibiotics over the counter. So I can say, go in and try to get this and this over the counter. So no, this is a diagnosis and a treatment visit. You can talk about things instead of coming into the office, but this is also built up. If somebody's bedbound, or do they look short of breath? Are they diaphoretic? Or are they in? You need to call 911 and get that patient in an ambulance. So no, this is a visit that treatment will be prescribed.
Now, Danny, you actually have done several of these, correct?
Yes, I have.
Share with our listeners, maybe from your standpoint as a patient.
Well,
you don't have to share any of the medical specifics, but
that would be highly entertaining.
But share with our listeners a little bit more about kind of what you've gone through in that process.
Yeah, well, first of all, I find it funny they're sitting here talking about, you can look at the patient and know if they need to call the hospital. I think a couple of times that I've done one of these house calls, I have not looked my best. There's been no makeup on. The hair has not been done. When you go into the doctor's office, you at least make an attempt.
Does Dr. Bound or does Toby, do they put makeup on?
I don't know. I haven't checked that out
They
yet.
haven't
They have seen me with makeup and they have seen me without makeup, and that is a terrifying experience for them. But let me just say, I'm probably your average Jane in terms of, I go to the doctor a couple of times a year. My family, we believe in preventative care and all that. So if anything ever seems weird, we're always apt to go to the doctor. But this specific thing with the video house calls has changed my life. I am a person who travels all the time for my job, and there is nothing worse for those of whoever's listening. There is nothing worse than being sick in a hotel room far away from home and be by yourself and not have that connection to find any solution to help you get better.
And so you've been able to use this in order to connect.
It literally, I've done it through my iPad. I've done it through my iMac at home, which you could use any laptop or whatever, and then my iPhone. So it's a matter of them sending me an email.
You did one with Troy on your iPhone?
I've done one on my iPhone.
Oh, tell us about that. I missed that, obviously.
Well, the iPhone is a little bit more complicated. I think we've done it once on an iPhone.
And on your side, you don't get a great picture of me.
I don't get a great picture.
But the camera is so good on the iPhone and on my laptop or on my desktop, I can blow it up to 26 inches and be able to really see her in high definition.
Yeah, so you're not really seeing the doctor too well. I mean, it's a little 2-inch little piece of them. But on an iPad, it works great. And on the iPhone, the whole purpose is, I am sick. I need you to consult with me. Please help me. And by them having that interaction with me, they were able to make a diagnosis and help me get better. And they have saved me when I have been on a road trip alone and not had any other form or fashion to get medicine.
Have you done these on a relatively non-emergency basis? Have you used these as a way to just have appointment done?
I have on a non-emergency, like, hey, I need to check in. I think we did a follow-up to a doctor's appointment. I've done a follow-up to a doctor's appointment before.
But a working professional, that's fitting in your schedule much better than going and waiting in the waiting room. And, if I get one sick patient first thing in the morning, everybody's backed up.
Right.
I mean, if somebody's sick, I have to stop and we have to take care of them. And then everybody's backed up. So
It creates efficiencies, I think, for everybody. And you think of the working moms out there. There are a lot of working moms out there. So we're managing our kids. We're managing ourselves. I've got other friends who use the smart house calls who it's word of mouth. I mean, the reason I came to Dr. Bond is when I heard about it, I said, where can I get it? And that was the reason that I started going to his practice, was strictly on smart house calls.
Troy, tell our listeners, we've got about another 4 minutes of our program for today. Tell our listeners, is this something that like most every physician here in the greater Athens area has, or is this something that right now there's just a couple that have?
Well, no, there's just a couple that have it, and there's some very unique people who have chosen that they want to be the leaders in what they're doing and how they're designing their practices. So this tends to really click with those physicians who say, you know what, there's people out there that I need to be able to connect with, and they need me in a much broader capacity than maybe they have thought in the past, or other physicians think that is in the past. And physicians like Dr. Bond understand that in order to decrease health care costs, especially with the new incentives and everything else that's coming out, we need to be there for those patients when they need us, and in a place that's convenient enough where they'll want to contact us. Otherwise, they end up going to the hospital and they go to the emergency room, and maybe they're admitted, maybe they're not. But anytime you walk into an emergency room, you're talking about a minimum of a $250 charge, as opposed to seeing your family doctor for whatever that is, $50, $100, something like that. It's a substantial savings.
It's your copay.
Yeah, exactly. Or essentially it's just copay. If you go into the emergency room, your copay is an automatic $50 or $100, and then on top of that, the insurance company's paying as much or more.
And Dr. Bond, most of these appointments are done during your regular hours, correct? It's not like this is an after-hours remedy.
No, we've done a few after hours on the weekend, but most of them, yeah, and a lot of them, we're seeing a lot of uptake with patients who have diabetes, who are struggling getting their sugars under control, and spending some time with them. Rather than them having to come in, sit in a waiting room for 45 minutes to sit there and talk, we can do a lot of these that way and evaluate their feet and make sure that they're taking care of themselves.
So, diabetes being a high one, how about high blood pressure? Do you see much with that? Or
yeah, we do. Yeah, we see a fair amount. Everybody, as cheap as blood pressure cuffs have become, generally you can find a good one now for $15. It's much easier to have them assessing their blood pressures and giving that data to you remotely.
Wonderful.
It takes the place of the old phone call when I can't see them. It's just a better feel on the situation, because people will call at 9, okay, take an extra blood pressure medicine, or I'll call in an antibiotic, or see me in the morning, or go to the emergency room. I mean, just going to the emergency room was a big intervention. It's like, no, I think you're sick. Go in. If you're in New York, say, okay, I'm not comfortable with this. I think somebody needs to see you tonight, and that's what you needed to know.
Well, and if I can interrupt, I was just on the road a couple of weeks ago, and there was someone that was sick, and I was like, oh, too bad you don't have smart house calls. And they're like, what is smart house calls? And I'm like, when I'm on the road, I get on the phone with my or video conferencing with my doctor. And they're like, well, how do I get a doctor that does that?
Well, I'll tell our listeners certainly to go to the website www.drtobybond, drtobybond.com. And if you click on the website, there are videos available. And when you go and you click on the videos, you will be able to watch one of the videos about the program. And
or the smart house call.
It's
a video of myself actually talking to Troy as the patient in the next room in a smart house call, just to give you a feel of it.
Well, it's neat in many ways how healthcare is evolving, and I think it is absolutely cool that this is taking place right here in Greater Athens, and we're leading the pack with it. So Athens, have a great weekend, and we will be with you next week.
You have been listening to the Athens Area Health and Wellness Roundtable with Dr. Toby Bond of TMB Medical. To learn more about TMB Medical and the topics we have discussed, visit www.drtobybond.com or call 706-548-9655.